She will tell me the moment.
Yeah.
Yeah, I think it's live now. Very good evening, everyone. This is Indrajyoti Sengupta from Shastho Bondhu. স্বাস্থ্য বন্ধু আবার আপনাদের সাথে উপস্থিত একজন খুব বড় ডাক্তার, একজন খুব বড় সার্জিক্যাল অনকোলজিস্ট, Dr. Shubham Garg is with us today. Welcome, Dr. Garg, to this program of Shastho Bondhu. Shastho Bondhu is a medical tourism company which assists patients across India and Bangladesh to get treatment from some of the best doctors and best hospitals in India. So this has been our endeavor to help people, and in that endeavor, we are organizing these programs with some of the best doctors in India. In fact, I am sure that you must have seen our programs before also, where we have had some of the best doctors coming in on board with us in this kind of an interaction. So today we have with us Dr. Shubham Garg, who is a senior consultant in surgical oncology. Dr. Shubham Garg is well versed in the management of all types of cancers, namely head and neck cancers, lung and esophageal cancers, breast cancers, gastrointestinal cancers, gynecological malignancies, and tumors of bone and soft tissue. Minimal access surgery in form of laparoscopic surgery for GI cancers and video assisted thoracoscopic surgery for thoracic malignancies is his forte. He's the founder member of term to tumorboard.co.in and non-profit online portal to provide second opinions to cancer patients and their caregivers. Dr. Shubham Garg has done his oncology training in Tata Memorial Hospital. He has got his qualification MCH in surgical oncology from one of the best hospitals in India, Tata Memorial Hospital. In fact, he was a special registrar also with Tata Memorial Hospital. He was also a senior consultant with Max Institute of Cancer Care, and he has professional memberships of some of the leading oncology bodies in India, such as the Indian Association of Surgical Oncology, European Society for Surgical Oncology, Indian Society for Thoracic Surgeons, Indian Society for Study of Lung Cancer. He has done his MBBS from Maulana Azad Medical College in New Delhi, his MS from Lady Hardinge Medical College, and followed by, he's also an international fellow of Yonsei University, Seoul, South Korea. His special interests are head and neck surgery, breast conservation surgery, esophageal surgery and lung surgery, open and minimal access for GI cancers, ovarian and gynae cancer, soft tissue and bone tumors. He has won some prestigious awards like the Accord Fellow Batch 2016 and Traveling Fellowship SO 2015. So a great introduction of a great doctor. Thank you, Dr. Garg, for accepting to be a part of this program. And we really welcome you with a warm heart to this program.
Thank you, Dr. Sen Gupta. I think it's my good fortune that I am on Shastho Bondhu, and yes, I'm very well aware of the credentials that Shastho Bondhu carries with itself, and I'm so glad that I could be a part of this program today. And I hope I can carry forward the good work that you do of educating the masses, of getting the message across. And
Right.
as you mentioned that, I had the good fortune of working at Tata Memorial Hospital, and we had a good share of patients coming from, the northern east part of our country and the subcontinent, especially Bangladesh. So we are somewhat aware of the usual cancer problems which patients from Bangladesh appear. And I'm so grateful for you giving me this opportunity to speak to through your channel and get to know people better.
Thank you, Dr. Garg. Dr. Garg, today the burning problem across India as well as in Bangladesh and across the world, of course, is COVID. COVID is something which we are very scared of. There's a lot of panic, there's a lot of anxiety, and a lot of people are very scared. In fact, just today, Just before the program started, I heard, the demise of
I lost your audio, sir.
can you hear me now?
Yeah, I can
Can
hear
you
you
hear
now.
me?
Yes, I can hear you now.
Yeah. So I heard the demise of two very close people known to me just before the program started, who died out of COVID. So today, COVID has become an enigma in the minds of people, enigma in the wrong sense, in the sense that it has created terror. आपको याद है वो मूवी शोले? आपको
Yes.
शोले याद है?
Yes, yes, I remember it. Yes.
गब्बर सिंह को याद है? गब्बर सिंह को याद है?
बिल्कुल, बिल्कुल.
तो ये कोविड तो गब्बर सिंह बन गया। ये तो
I,
आके हम लोग का जीवन को एकदम गोली से, वो कोविड का गोली से खत्म कर रहा है। और वो बोलता था ना, क्या बोलता था अमजद खान, कि बच्चा बच्चा बोलता है, कि माँ बोलता है सो जा, नहीं तो
so,
गब्बर सिंह आ जाएगा। तो अभी कोविड वैसा है, माँ बोलता है घर में रह जा, बाहर मत निकला, नहीं तो
yes.
कोविड पकड़ा लेगा। तो वही हम लोग का
it's it's
सिचुएशन आ गया
it's
है।
I know it's very unfortunate. I have two small kids. One is in a second class, and the other has just joined school this year. And COVID has become their lexicon. They know about COVID. My younger daughter tells me that, Papa, I can't go to school because Corona is there. So they have got, their vocabulary has included COVID into it, and it's so sad to see them at home all the time. It's really difficult to keep them occupied, and I think all of us, including the kids, are bearing a bad brunt of it. And I hope that somehow, some way, we can get out of this. But till we are out of it, I think it's very important that we understand about COVID and the things around it, so that the normal life around it does not get dissipated much. That is very important.
Absolutely, doctor. Doctor, and in fact, that is the purpose for which we have invited you today, because the normal people, they are getting COVID, but they are somehow managing their lives. Many of them are getting mild diseases, many of them are asymptomatic. But now the problem is with cancer. Cancer is a major comorbidity. In the list
Yeah.
of comorbidities of COVID, like diabetes, blood pressure, I think cancer, heart, all these are some of the major comorbidities that we find. So here, the understanding of how COVID can affect a cancer patient, and what a cancer patient can do to save himself from it, and how can a cancer patient continue his treatment in spite of, in this COVID scenario. These are the things we would like to learn from you. So my first question to you: are the symptoms of a COVID in a cancer patient the same as that of a normal person, or is it different?
So I think it's very important to recognize COVID in any immunocompromised or in a high risk population, and cancer is no different. So I would say that the patients of COVID who have cancer, or patients of cancer who get COVID, they would have similar symptoms to a patient who does not have cancer, but the chances of rapidity of them deteriorating are much higher in a cancerous
Okay.
patient than a non-cancerous patient. And for the simple reason that the cancer patients that we know of are somehow have lesser immunity. They have some sort of compromise. Their body is already fighting a chronic disease, and their body defenses might not be strong enough to actually uh, tackle COVID as well as a normal person might be. So
Okay.
in our clinical experience, patients who have cancer and are on some form of treatment, especially, they are more predisposed to get a serious form of a COVID infection than normal patient. Their symptoms might be similar to that of a non-cancerous patient in COVID, but the rapidity in which the deterioration will happen will be much more faster than in case of a non-COVID patient. That is why you have to be more careful in such patients.
Understood. Understood. Okay, doctor. There are, basically three types of, cancer patients. I think one is the one who are, maybe getting tested to see whether they have cancer. Number two is already going through treatment, and number three is already who have got treated, now going to follow-up treatment. So these are basically the three kinds of cancer patients that we find. Now, let us talk of those patients who have already got a cure. They have got a cure in cancer, and maybe they are doing some follow-up. So in those cases, is the risk the same? Is the risk the same as a person who is getting through treatment in cancer, like one who has already got cured and the one who's taking treatment? Is there a difference in the risk level
So,
of
so,
these two?
so, so this group of patients who have already got cured, okay, and who are on a regular follow-up, I think they are the safest kind of patients of cancer for COVID. Why so? Because they have already completed their treatment. They have already won the war against cancer, and then now they are almost leading a normal life. Some might have some trouble, but most of them are almost leading a normal life. They just go to visit a doctor once in 3 months or 6 months as per their follow-up schedule. And that is what our recommendation to such patients is, that they should avoid coming to doctors at this point in time if they are all right, if they don't feel there's any recurrence of disease. And they can at this point in time take a teleconsultation, get the reports done at their local place. And even if they can't get a report done and they don't have the facility of a telemedicine, they might hold back, sit tight at their places and don't venture out for the next 1 month, because that is what we expect, that with time the peak of COVID will come down, and those patients then can come after 1 month and then show to us. But if they feel that they have any symptom, or if they have any sign of the disease coming back, then they are as bad as the first category, where they are newly diagnosed patients, and then they have no choice but to come and visit us actually.
Doctor, here, the question that comes to my mind is that you just said a person who has cancer, his problem is that his immunity level is lower than a normal person. As a result, the infection may spread faster and the deterioration might be worse. This is what you said. So now, isn't the same for a patient who's already cured of cancer? Doesn't his immunity level go down because of cancer, although he's now cured? But don't you think that the immunity may not be the same as it used to be before cancer? Or
So,
is it, does
so,
it go up to that level again?
so a patient who is currently having cancer, he might have some effects due to cancer, such as their diet might be altered. They might not be able to breathe properly. They might not be able to pass stools normally, so their bodily functions are not working at the same level as of a patient who has already got cured of cancer. Second,
Okay.
suppose those patients who are already got cured of cancer, they don't have a psychological fear of getting a worse disease. The problem, half of a patient that we feel, is that they get into a negative frame of mind, as that they feel that cancer was bad enough, and now that they have got COVID, they might even fare worse. That place is lost with the that mindset is lost with the patients who have already got cured of cancer. They are actually super strong patients, because they have already come out of a very bad disease like cancer, and they feel now they can handle COVID because they have already come out of cancer. So it is not that after you have got cured of cancer, your immunity will continue to stay low. No, it's not that way. Once you have a normal lifestyle, once you start eating normally, once you come out of your chemotherapy cycles or radiotherapy cycles, you are as good as a normal person. We don't feel that they would
Great.
be highly predisposed to getting a COVID infection.
Great. Great. We welcome Arifun Dupu from Bangladesh, who has joined. Arifin is a very good friend of mine also. He has congratulated us for this program. So, Dipu, welcome to our program. And we hope Mashur Bhai has also joined this program from Bangladesh. Mashur Bhai is from the HR fraternity of Bangladesh, a very well-known personality. And Mashur Bhai is very popular for his singing.
Wow.
Mashur Bhai, thank you. Thank you for joining, and you are enjoying this program. Thank you for, this motivates a lot, and we are going to get more answers from Dr. Garg as we move on. So, doctor, how should a cancer patient or a person who must have got cured of cancer be safeguarded if someone already has COVID in the family? You see, today someone in the family may have COVID. Now, there is a cancer patient already in the family. So how should that person be safeguarded? It's a joint family. So how should that person be safeguarded in such a situation?
Yeah, so that's a burning issue that, almost all households that I know of, somebody has got COVID. So it's becoming a challenge to how to safeguard, the more immunocompromised patients or more susceptible patients. So the only way to do that is to reduce their interaction. They should be preferably, we should allot them a room, which is their room. We should minimize going in and coming out of that room. That patient should have limited movement out of the house. They should have least amount of interaction with people outside. If there is somebody who comes into the house to work, such as a house help, they should avoid going into that room. uh, it is just better that we it's you can put it as a kind of a isolation for that patient, that their interaction with a lot of people is reduced. They it's not important that their food should be separate, or their eating habit should be different. They can continue to have whatever is happening in the family as such, but their interaction with other people in the house who actually go in and go out more often, that person should be limited. That is most important.
Okay, Dr. Garg, I think one of your acquaintances, Puneet Sharma, is on the show.
Oh,
He
yes.
has written,
Welcome.
I am in
Yes.
Dr. Shubhamji. He's written, I
Oh,
am in
Puneet,
Dr.
Puneet,
Shubhamji.
yes, Puneet is a very lively fellow, and I must tell you, he's a cancer champion. I put them as champions, not even as survivors. He has managed to defeat one of the biggest cancers. I will not divulge the details, but he's a really great supporter for us. I am so fortunate to know Puneet, and he's comes to our support groups also, and he's a really a lively personality. Thank you, Puneet,
Congratulations,
for
Mr.
joining in.
Sharma. Congratulations, Mr. Sharma. It was so nice to hear about you from Dr. Garg, that you fought a fatal cancer, and today, you're still, living your normal life. I think people like you motivate us, and we feel we can also overcome this COVID situation that we are facing. We will overcome the second wave. हम होंगे कामयाब, क्या बोलते हैं डॉक्टर जी? हम होंगे
Definitely,
कामयाब, आपको क्या लगता है?
definitely. Yes, yes. Not kamyab, and we'll come out stronger. We'll come out stronger. We will carry this scar as a scar of victory, and we will continue to win over this, and things which are still in store for us, and we don't know what's there to happen.
Yeah, but I'm just praying that we can overcome. I'm sure science is also moving towards that side. We are already vaccinated. We are taking vaccines, so we hope things will improve soon. Now, doctor, the next question that comes to my mind, maids are a part of every household. Without maids, we cannot live our lives. That's how we are, Indians, and we all know they could be potential carriers. So, should maids be let into any household which has a cancer patient in this circumstance, in this present situation? Do you think, maids, especially people coming from outside, should be allowed to work in a household which has a cancer patient? What is your
So,
take on that?
like I said, that we have to minimize interactions from outside people. So, I agree to the fact that they are indispensable to our lifestyle. It is very difficult to, continue our daily routine without their help. But I will give you an example. In the first lockdown last year, April to June, when we were really very scared, we there was a time when there was no house help. Even the house help was scared to come, and we were so scared to get them into the house, and we divided the chores amongst ourselves. Me, my wife, and my parents were there, so, and we managed to do them. But this time around, getting to know COVID better, we are allowing some house help. So it is not that they cannot be allowed, but you have to maintain a distance with them. You have to ensure that their interaction with the cancer patients are limited. You shouldn't ask them to go and serve food to them. You can go and serve food to them, and they can work in the kitchen as such. It is recommended, and this is what we do at our house, that whenever a house help comes, we ask them to change their clothes, we ask them to wash their hands, we give them different slippers so that they maintain some sort of sanity, some sort of sanitation, and when they go back, they change into their old clothes and go back. So probably these little precautions that you can do can minimize the entry of COVID in your household.
Okay, okay. No, like what I wanted was that should special precautions be taken in a household which has a cancer patient? This is what we do in normal household.
Yes.
But where there is a cancer patient taking treatment, that is more vulnerable. That
Oh
situation
yes.
is more vulnerable. So in that case, what should be done?
Only isolation, minimum interaction with those patients is the only way that you can safeguard those patients. That is the maximum
Okay,
thing.
okay. We have Tashmeem from Bangladesh with us, and welcome Tashmeem. Tashmeem again is a very good friend. He's one of the young bankers of Bangladesh who
Oh
has
wow.
done very well for himself. So, Tashmeem, thank you for joining in. And he has a question for us. Although not directly linked with the session, will India face the third wave, or is this the last wave? According to Tashmeem, he has a curiosity. He wants to know whether this is the last wave in India, or will we have a third wave again in India? Although
So
this has got
so
nothing to do with this. This is his
yeah,
question.
yeah, yeah. So, Mr. Chaudhary, thank you for joining in. And let me confess, I'm not an epidemiologist, so I don't work with public health. But being a student of science, I can just give you this that whatever we have learned in the past 3 to 4 weeks is that you cannot be callous in your attitude. You cannot take things for granted. Nobody predicted that the second wave would be this bad after the first one that we had. Previous experiences, especially with the Spanish flu, which was 100 years back, has shown that the third and the fourth wave do happen. Although, just like this wave, they might be even shorter, but they will have an acute rise and an acute fall. But you never know what's in store for us. The only way to know is time will tell. But what you, I, and everybody else can do is to continue precaution, continue to maintain the new mask behavior that we have learned, continue to maintain a distance, avoid social gatherings. And vaccination, I think, will be a big game changer with this. We have seen it working in the West with the Americas and the Europes now opening up. So we can only look forward to and hope that with the vaccination picking up, probably the third wave, even if it comes, will be much shorter, smaller, and would create a lesser of havoc than the second one has.
Great. I think Tashmeem, you got your reply, and I also was seeing a video today which says that the third wave, even if it comes, it come after 6 to 8 months, and it will be much shorter than the second wave, and it may not be as damaging as the second wave. Like the first wave, and that's how it happened with Spanish flu also.
Yeah,
Spanish flu,
yeah.
the first wave wasn't so deadly. The second wave was the most deadliest, and the third wave again was much lesser. So we expect the same pattern also to happen maybe in this pandemic, and that's how what we pray to God, because we don't want this to happen again. It's wreaking havoc in our lives. So we also want a respite. So we will all do Corona Puja, and we will, if Corona tells us, we'll worship Corona, but spare us, please. That's what I can only say. Okay, doctor, what I'm understanding from you that if there is a cancer patient at home, just like a COVID patient should be isolated, the cancer patient should also be isolated from the family also. Because, like for example, my next question to you was, suppose no one has COVID at home, the family is free of COVID, but we also don't know, there's this thing called asymptomatic. So people don't test if they are asymptomatic because they don't even know they have COVID. So should cancer patients mingle with the family members even if they don't have COVID? What is your answer to that?
So I would say that only necessary interaction should be done. It should not be a free for all kind of stuff that you are celebrating birthdays, you're celebrating
So
anniversaries.
you're watching television together. Let us say, we in our families we are watching television together. So what is your view to
Yeah.
that?
So obviously you can watch a television in the same room, but you should not be piling upon on the same 6 feet bed trying to watch television. You should have some distance. You can segregate your time, that sometime the one person is watching, sometime other person is watching, because the cancer patient might not go out of the house, but somebody is going out of the house to earn a living. Somebody is going out of
Yes.
the house to
Yes.
get food. So once they
Yes.
go out for whatever needs that they come back in, and whatever precautions you take, you might carry some virus with you, and that virus might become detrimental for that patient. So it cannot be a hard isolation as it is for a known COVID patient, but at least we should try and ensure that there is as less interaction within the family with that cancer patient.
Great. I understood. So the best thing is for a family which has a cancer patient to minimize the interaction with the family members, with the maids, with all kind of outsiders. Try to keep that patient in isolation as much as possible. That is better.
Yeah, isolation is a very hard word, because with the COVID isolation coming in, I don't want the cancer patient to be just put in one room and nobody speaks to him, just like we do with the COVID patient. I would say minimum interaction, not isolation, would be too hard a word, I feel.
Okay, great. Okay, doctor, how frequently is it necessary for a cancer patient to do a RT-PCR test on a routine basis?
No. So RT-PCR should only be done if you feel that there are some symptoms, or that person has come in contact with a proven case. So I will give you an example. Suppose in the household a person develops fever and he is found to be COVID positive, then it is important that that person, whoever has got exposed, whether it's cancer patient or not, should get a testing done to ensure that they are COVID free or not. But a cancer patient who is actually undergoing treatment would require to get COVID testing done repeatedly, because even if they are going to undergo a surgery, they will require a pre-operative COVID testing. If they are going to get chemotherapy, they are going to the hospital. Before each cycle, they would insist on getting a COVID RT-PCR done. Even from before starting radiotherapy, we insist on getting a RT-PCR done. So anyways, the cancer patient, if undergoing treatment, would get multiple testing done. But there is no criteria to get routine testing done until unless they have symptoms or they have been exposed to a COVID positive patient.
Great. Okay, doctor, how important is it to check the oxygen saturation level for both cancer and non-cancer patients? Like, today we have those little oximeters
Yes.
which we put in our fingertips. So, how important is it to check this oxygen saturation level for both cancer and how frequently should we check it, both for cancer and non-cancer patients?
So if you are COVID positive and you have symptoms, then we recommend that you check it 2 to 3 hourly. You should make a chart, you should make a table, and you should keep on writing, because see, these are little things that you can do yourself and you can do at your home without any need for a doctor. This is the minimum thing that you can do, and you don't need to get very expensive equipment for this. This is easily available. So even for a cancer or a non-cancerous patient who have got COVID, they should do a self-monitoring where 2 to 3 hourly they can do SpO2, as we put it, the oxygen saturation charting. And it is not necessary that you should get alarmed at anything less than anything above 95 is good for you and me, but there should not be a falling trend. What I mean by a falling trend is, today it is 100, tomorrow it is 99, day after it is 98, then it becomes 94, and then it becomes 92. This is not good. However, if you are 98, 97, 98, 97, 98, this is good for us. Nobody will have an absolute 100%, but what you should ensure is that you should document the trend. If you feel that the trend is falling, your fever is not abating, then it is a cause to raise alarm and to seek medical help.
No, let us say, doctor, a cancer patient or a non-cancer, suppose a person like me who doesn't have cancer also, how important is it for him who doesn't have any symptom, and say I am vaccinated also, I've got both my doses, my last dose was 19th April. So is it necessary to check my Spock every day or every morning, evening? Is it something like that? Is it necessary?
No, definitely not. If you don't have COVID or any symptoms of COVID, then there is no point checking your SpO2 levels or the saturation levels. It will not make any difference. It will not make any difference. Please don't get into that practice of unnecessary. It only increases your stress level. It only increases your
Yes.
stress level. So it's very important that
Good advice
we
for
get this
me.
out of
This
our
was an
mind.
advice that I needed, not the cancer patient. Because I've been doing this for many days. I get up in the
No,
morning, I take my Spock. In the night, I go to sleep, I take my Spock. And
it
my
is not.
wife is getting pissed off with me. She is like, every time I go and tell her, and she puts her hand on her head and thinks, what am I
Yes,
doing? So, people in my family have started thinking I've become mad, actually,
that
with
is
the
what
Spock. That's
I hope Mrs. Sen Gupta is now happy with my answer, that I have get this off
in
Mr.
fact,
Sen
I've been
Gupta's
telling
mind.
her, you also start taking. I have been telling her, you also
No,
start taking your oxygen.
no,
No,
no, sir.
actually, what is happening, doctor? Suddenly, I hear people dying, and that is what has
Yes,
prompted me that I should, constantly monitor myself. That is a kind of a thought process that I'm going through. So
So
good, you
I
told
put
me.
it, yeah, I put it this way,
Hmm.
that fear is good. You should be fearful, but excessive fear. I put it in Hindi actually. चिंता चिता से ज्यादा होता है. आप समझ रहे हो? चिंता चिता से
Yes,
ज्यादा होता है. If you take too much stress, even that is bad. But you should be scared enough, so only you will follow the rules.
yes, I fully appreciate with you. This is what how it should be. Okay, doctor, is a COVID patient more vulnerable? Is a cancer patient more vulnerable than a normal patient when COVID happens? You said yes, because you said the immuno
Yes,
system gets affected. So it
yes,
definitely is. Okay, okay,
yes.
doctor. Okay, there are certain medicines which are recommended for immunity for normal people. Like we
Yes.
have those, tablets, vitamin, and certain immunity tablets that are given. So can that be given to cancer patients also? Is it okay?
Yes, they can be given to cancer patients. See, a lot of things we don't have evidence for. For example, I will tell you that there is people use curcumin or haldi, as we say, that it is found to be helpful in cancer. We might not have evidence for that, but we don't even say no to a patient who's already doing that, because if it's natural, if it's not harming, then we are not against it. So any patients who feel that a immunity booster like vitamin C, like zinc, like multivitamins, like B complex will not harm a patient, and both cancerous and non-cancerous patients can take them to safeguard them from immunity. But if somehow it is not available or they are not able to afford it, because please understand, there is a group of people who might not be able to afford this also, they should not clamor for these things, because they might have an effect, but it is not absolutely necessary to have them. If you can afford them, if you can have them, please have them. But it is not a, it's not what you say, a ramban or a something which will help you definitely. But if you can afford it, you can surely have it, and they will have no major side effects.
These immunity tablets are not vaccine. They do not save you from COVID.
Definitely, they don't, they are not vaccines. At best, what they can do is that even if you get COVID, they will give you a milder form of infection. They will help you in early recovery. So this is documented that patients who are healthier, and all these promote a healthy lifestyle. Patients who are healthier, who have less vitamin deficiency, they do better even if they get COVID. So the aim of giving these nutritional supplements, which include your vitamins, your zinc, is just to build up your immunity, so that the minimum that we can do for these patients is that they get a lesser form of infection.
Great. Okay, Dr. Puneet Sharma, Mr. Puneet Sharma has a question. He's asking, is there any medicine which is restricted for cancer patients but necessary for COVID patients? Like anything, a COVID patient can have, but a cancer patient, in spite of getting COVID, may not be able to have. Is there kind of any medicine restriction?
So I will tell this to Puneet, that when you are looking at cancer and COVID gets priority, because COVID is actually something which might become life threatening in a span of 5 to 7 days. So although there is no single medicine which is available for COVID and restricted for cancer, but there are actually the other way around, that there are some anti-cancer drugs which are now finding more and more use in COVID, which include bevacizumab and tocilizumab, that I think most of us have come to know. So there is no such medicine which is restricted for cancer patients but have to be used in COVID. Even if there was a medicine, I would say that it would be given for COVID patients, because COVID takes priority over cancer treatment right now.
Which is more dangerous, doctor, COVID or cancer? For you, what take do you have on this?
So I will put it this way. A lot of people ask that. So if you get into a car accident and you have a head injury along with a fracture of your arm, the head injury would take precedence. And right now, COVID becomes that head injury, because if you get COVID and if the COVID, the rapidity with which the deterioration happens is not seen in cancer. Actually, cancer might give you still 3 to 6 months to salvage, but COVID patients, we have seen their condition drops down drastically. They go on a ventilator, and then there's a bleak chance. So I would say that COVID gets the priority over cancer.
Okay. Doctor, tell me, why does this happen? But this doesn't happen to all COVID patients. This happens to a very, maybe a smaller percentage, isn't it? Like this deterioration, does it happen to all COVID patients, or is the number,
there is no thumb rule, but it is seen that patients who have some form of comorbidity, which includes chronic diseases like cancer, like diabetes, like some cardiac illness, they would have lesser of their body to tackle COVID. So this is seen that most of the patients who have some form of comorbidity would have a more difficult course through COVID, and they are the ones who are more likely to deteriorate. So not all patients go through it. We know of so many patients who were at home and got all right with home isolation, and that is why when the vaccination started, they started vaccinating people who were in the 60 and the above age group to take care of those patients with more of comorbidities. And that is why that was the thought behind vaccination, to start that we should tackle those patients who are more susceptible for getting a bad kind of COVID disease.
Tell me, doctor, suppose if I have a comorbid condition and I have taken both my doses and it's now say around a month. So what is your thought on this? That what like if I get COVID, then do you think it will be as bad as it would have been had I not taken the vaccine? Or it doesn't, the situation doesn't change whether I am vaccinated or not. Like suppose I have suppose I'm a diabetic. What is your take on that?
So vaccination will definitely help you that you will get a milder form of COVID infection. That is what we are seeing in a lot of our community, in a lot of our senior people who are getting COVID, that they will get a lesser form of COVID. Your COVID will not be that significant, or
it won't be life-threatening.
It might not be life-threatening. I will not put it as that it will not be. It might not be life-threatening. It will be of a lesser severity. But I will put this way, that if you have a comorbidity, like you said, that probably you're diabetic, I would say that your threshold of seeking medical help and your threshold of probably increasing your treatment should be lower. You should not wait for too long to seek medical help or to get admitted. If you feel that you have more of a comorbidities, you are at a greater risk of getting a more serious type of COVID, and that is why you should expedite your treatment if you feel that you are not improved.
Okay, doctor, here I have another question. Say, suppose if I'm diabetic and my diabetes is under complete control, my sugar is under complete control. There is like, suppose if my fasting sugar is around 120 and my PP is around 130 and I am on insulin, then even do you think in spite of complete control of my diabetes, things might deteriorate? Like where my sugar is under complete control, means there is no kind of, yeah, you got my question.
Yeah, I got your question. Let us prepare a chart. So the worst affected would be patients who have multiple comorbidities. If you're diabetic, hypertensive, and you have a heart condition or a kidney condition, then would be those who have uncontrolled diabetes. Then would be those who have diabetes which is well under control, and then would be the normal people. So you will not be as at risk as patients who have uncontrolled diabetes, but you will still be more at risk than patients who have no diabetes.
Okay,
And
great. Thank you very much.
we don't have absolute numbers to help us with this, but this is a sort of a ladder which you can keep in your mind.
Fantastic, doctor. Okay, doctor, next question that I have is, say suppose we do a lot of pranayams and breathing, like I myself do a lot of pranayams and breathing exercises. So for a cancer patient, can pranayams and breathing exercise help in any way? Like it can help us? Is it
Oh, yes, definitely. I am a firm believer in uh, doing yoga. And see, the first thing that you should understand is that it gives you a sense of discipline. Doing exercises, doing a form of yoga will give you a certain discipline in your life, and you are more likely to follow rules if you are a follower of a practice, because
right?
by insect you are more disciplined, that you're daily getting up and doing 50 pranayams or 20 shishasana and doing stuff like that. But uh, doing any breathing exercise at this point in time has shown that it will improve your lung capacity. We are getting more and more patients who we feel that those who had a better lung capacity, which could be because they had more of physical activity to do, or were not in a sedentary lifestyle, probably not, they were not office goers, they do better than patients who were obese or who had a poor kind of lifestyle. So definitely things like pranayam, things like alom vilom, things like doing a regular yoga will definitely help patients, whether they are cancerous and non-cancerous patients. I would just put a word of caution to cancerous patients that, cancerous patients could be fragile. They might have, I would not want to push them to do extreme exercises. I would just request them to do something which is within the framework of their disease. They should not exert too much. They should stay within limits. They should not go overboard in trying to do extreme form of exercises. Doing simple Kapal Bharti, doing simple Alom Vilom will help them. They should not try to go beyond the reach of their disease.
Yeah. What if you just shared a beautiful ladder where you said the most susceptible are people with multiple morbidities. Then you shared, people who have got uncontrolled morbidity, comorbidity, and then you said controlled comorbidity, and then you said people with no comorbidity. Now, if I have to ask you a similar question, someone who's a regular pranayam doer or a regular, doing regular breathing exercises, if this is one kind of group and the other, doing nothing really, how would you put these two if I had to compare, in getting COVID and fighting with COVID? Which one would you? How would you rank that as a ladder? Like if you had to, if I had
So,
to, ask you to put that.
so getting COVID has nothing to do with exercising. Getting COVID has nothing to do with, everybody is equally susceptible to get COVID. It is
Right.
your exposure. It's your exposure to COVID, and that exposure to some extent is in your hand. But definitely people who have a healthier lifestyle, which includes better eating habits, which includes a good body weight, a balanced body weight, which includes people who do regular exercises, they will have a lesser severe form of disease and probably better
Excellent.
recovery than patients who have an unhealthy lifestyle, or who don't indulge in any kind of exercise, or those who have
Super.
multiple comorbidities.
Super. I think this is what I was expecting. I think the audience, this is something very important, যে উনি যেটা বলছেন যে এক্সারসাইজ করতে হবে, আমাদের প্রপার খেতে হবে, we have to eat properly, we have to have a proper good food habit, we should do pranayams, we should do breathing exercises. You see, we also have to play our part to defeat COVID. If we do not play our part, we will not be able to defeat COVID. So we all have to, do our part. Now here, doctor, I have a question for you. You just said that exposure to COVID, how much you've got exposed, and that is in our hand. Now, I could not understand the meaning of that particular part which you just said. Exposure to COVID, and that is in our hand. What does this mean exactly?
So what I meant by exposure to COVID is the more you are going out, the more you are interacting with people, the more you are working in crowded places, the more you are not wearing a mask, the more you are exposing yourself to get COVID. So that is in your hand. If you maintain social distancing, if you wear a proper mask, if you avoid crowded places, if you don't go out for unnecessary work, if you avoid social gatherings, you are reducing your chances of exposure to COVID. So the exposure is in your hand, and no form of exercise or can change this. Exercises, eating habits can only improve your chances of recovery, but extent of exposure, chances of exposure is in your hand, and that is why we always believe prevention is better than cure. Even if you get a cure for a disease, you would still want to prevent it, won't you? So that is why we are saying that
Absolutely.
you should try to prevent acquiring COVID. And COVID, believe me, is an acquired disease. It's an acquired disease. You go out, you will get COVID. If you try to stay in, there are less chances of getting COVID. It's not an absolute,
Here,
again,
doctor.
it's not a, yes, I got what you're going to say. But again, I would say that it is the chances of a person who's going out regularly working are much more than a person who's sitting inside the home not going out. Although I also know of many people who have not ventured out and still got COVID. So I will say these are not absolute, but you and I should propagate that we should try to minimize our exposure.
Okay, okay. No, doctor, here there is a very, something which is going on in my mind, and I've been reading a lot about it also. That there is something called aerosols, which can go up to 10-meter
Right.
distance.
Yes, yes, yes.
So, this is something I wanted to know. What is this? And
So
this is a confusion that in spite of
no, no,
not
no.
going out, I'm having COVID. Is it coming through the window? If I keep my window
No.
open, is it coming through the window? How is it happening? What is happening?
So, what is aerosol? Aerosol is a liquid, a particle of fluid which is aerolized. So, I will give you an example. Take a bottle of a deodorant. It has a liquid which is kept in a pressure, and you press it, a stream of fluid comes out. This is
Correct?
aerosol. Okay. So,
Okay.
when a person sneezes or when a person coughs, they emit a stream of that wet fluid which is known as aerosol. Okay. Now
Okay.
the virus is very heavy, then the chances of that aerosol flowing is much the chances of that aerosol flowing is lesser because the virus would settle down. But if the virus
Mm.
is very small, then it will travel a longer distance, and that is the science behind using a mask, both for a person who's not having COVID and a person who's having COVID. That if both the parties wear a mask, then the person who's emitting that aerosol by being COVID positive, the mask will act as a barrier, and that aerosol will not emit. And the person who's not having COVID but wearing a mask, having that barrier, the COVID particles will get deposited in the mask and not get to that person. Now, with the
Okay.
newer evidences coming in, there are reports that that aerosol can travel as far as 10 meters. But again, these are just presumptions, and it is you can put it this way, that the more forcefully somebody creates that aerosol, the longer distance it will
Okay. So do you suggest that we wear masks at home also? Is that a
go.
suggestion that you have for everyone?
When the second wave started, there were some news articles also that with the amount of COVID that we are seeing right now, we don't know who's positive and who's negative, and you should start wearing a mask at home. But the only problem is that it's not a foolproof strategy. It's not a foolproof strategy. The intent is that only if you know of somebody who's COVID positive within the home, then you can isolate and then you can start wearing a mask. But within a confines of a home where everybody is not COVID positive or is asymptomatic and not showing any symptom, then it is not does not make sense to wear a mask all the time.
Great. Thank you. I think that was a great thing. What about cancer patients home? Should they wear masks? Because a cancer patient is more susceptible to
Yes,
this
yes.
disease. So
So
what
so
is your
they
suggestion
they
for yeah?
so so they suppose they stay in a one house dwelling only where they don't have multiple rooms, then instead of isolating, they can do this, that they can choose to wear plain cloth mask just to avoid their exposure or decrease their chances of getting that infection.
Great. Okay, doctor, can cancer patients give vaccines? Is it possible for them to give vaccines? And how safe is it for them to take vaccines?
So I think that is the elephant in the house that we should address, and I think that is very important to talk about vaccination. So like you spoke before, that we have three kind of cancer patients. I would for vaccination, I would segregate into only two kinds of cancer patients: one who have completed their treatment and now are on regular follow-up, and one who are undergoing active cancer treatment, which could be in the form of surgery or chemotherapy or radiotherapy. So for patients who have completed their treatment and are presently on a regular follow-up, for them, vaccine is as safe as it is for a normal individual like you and me. And there is no absolute denial in offering them vaccine of any make and of any schedule. They can choose any vaccine which is made available to them, and they could follow whichever is the schedule which has been prescribed by the governing authorities at that time. Now, the problem comes with patients who are actively receiving treatment, and that treatment might be, sometimes a lot of our treatment might itself tamper with the patient's immunity. And most important example is chemotherapy. When you give chemotherapy, some of their blood counts actually go down and their immunity might be compromised. So in a patient who is actually undergoing treatment for cancer, I would suggest that they should meet their treating physician once. For me, a patient who's undergoing chemotherapy, I do not recommend vaccination for them during chemotherapy. They must wait before they can take vaccines. But a patient who has undergone surgery and is not planned for chemotherapy, after completion of surgery, after 2 weeks, they can definitely take vaccine, provided they are not planned for any form of chemotherapy.
Great, great. So people who have already got cured, for them, vaccine is just like a normal person. But
Absolutely.
The ones who are going through treatment should not be taking it. That is because, chemotherapy has its own side effects.
So I would put it differently, that they should talk to their treating physician one, because there are different grades. Okay. Yes, there are different grades of chemotherapy. There are some which will not affect their immunity, and then they can be choose to take treatment.
Okay. Okay, doctor, in case a cancer patient gets COVID, should he stop his medication, the medication for cancer?
Oh yes, that takes the priority. I gave the example that COVID take precedence over cancer treatment, and if they are on any form of treatment, especially chemotherapy, radiotherapy, they would have to withhold chemotherapy as well as radiotherapy. This is not only in their interest, but the interest of the people around them also. It has happened that we have had to stop radiotherapy in between for many patients who turned out to be positive accidentally. And this was so because if they become COVID positive and we continue to treat them in the facility in the same radiation room as the other patient, then the chances of exposing other healthy patients to that patient increases. Secondly, there has been scenarios where we get a pre-operative COVID testing done. Now it has become mandatory before taking any patient for surgery that you should get a COVID testing done. And it has happened that the patient has come out to be COVID positive, although they might be asymptomatic, but we have had to defer their surgery for as long as 3 weeks till they become all right. And even when they become all right, we get a CT chest done for them to ensure that there are no residual diseases, effects of COVID, so that once they go in for surgery, they come back as good as new after surgery.
Okay. Okay, doctor, suppose a cancer patient gets COVID. What is your advice to him? How to tackle the COVID? Because that is, further panics the family as well as the patient. So how should a cancer patient treat COVID? Like if he gets COVID, what should he do? What are the steps he should be taking?
So the first step for a cancer patient to who has got COVID is to take the cancer out of the equation. For them, the priority becomes COVID. Now, you don't have to think of the bigger picture that, what I will do after 6 months and how will chemotherapy affect me, because now COVID is the priority for you. So you should start, keep COVID, cancer out of your mind, keep COVID in front of you, and that should be your priority. Second, like I said, they are more susceptible to getting a severe form of COVID because they might be immunocompromised. So in that case, you have to have a more stricter protocol around them. You have to ensure that the alarm bells start ringing at a lower threshold than for a normal patient. Okay, you have to ensure that you maintain a strict protocol around them. They should have minimum interactions. If you feel that any point in time they are getting worse, there is a sudden drop in SpO2, they should be taken to a hospital, and it should be made declared that they are the priority, because these are the patients who will get worse fastest as compared to other patients. Okay. Third, always keep your cancer physician involved. Let them know that that is the reason why you are stopping your treatment, so that once you become COVID negative, or once you have recovered from COVID, they can factor that in when they restart your treatment, so that if you were to again get immunocompromised, there is no reactivation of COVID infection. So it's very important that you should declare that you have had COVID, and you should keep your primary physician involved.
Okay, great. Would you suggest to the families of cancer patients that they have oxygen always readily available, like may not be at home, but because they are more susceptible, as you said? So, would it be safe? Like the moment he gets to know he's got COVID, isn't it better to admit him to a hospital? Because the situation may suddenly deteriorate, right? That is something which is coming.
So, like I said, you should have a lesser threshold of shifting them to a hospital, but it should not be a knee-jerk reaction that you get them admitted into the hospital, or you preemptively start them on oxygen. They would require strict monitoring. But believe me, if they are to be admitted in the hospital on the first day itself, they will get so much of a psychological setback of being in the isolation when they're all right, that they will not recover. So I would not recommend that they should get immediately admitted, but you keep a watch on them, and ensure that if you find even slightest form of deterioration, you should get them to a hospital.
Great. Doctor, with this COVID, another thing that has, I was talking to a heart specialist maybe a month back. And in fact, I was going through this COVID anxiety, as he said, and I went to him and I was discussing, and he said, all your reports are perfect. You have nothing to worry. Why have you come to me? So he said, this is a common thing that is affecting many people across the world, which he says is anxiety disorder or COVID anxiety disorder. This is the word he used. Now, my question to you is that how does anxiety affect a cancer patient? Like we can, deal with it. I do meditation and a lot of things, and I can control it. But for cancer patients who are already fragile, as you use the word fragile, I'm sure panic and anxiety affects them in a big way. So what kind of an effect will it have on them? And what is your advice to cancer patients as well as their families? How to keep panic and anxiety away, and how will this affect their lives? So if you can throw some light on it.
So what anxiety does, it prompts us to take irrational decisions. If you're too anxious, it prompts you to take irrational decisions, which might include, just like you said, getting them admitted early inside the hospital, or starting them on oxygen straight away, or maintaining a more stricter protocol around them. These are all panic reaction, and in the larger interest of the society, this is how hoarding of oxygen cylinders and unnecessary filling up of hospital beds happen. So panic is not good. But on the other hand, like I said, that being a little more anxious helps you in being more cautious with the disease. It is not that you will succumb to that disease, but if you are a little anxious, it will help you in maintaining that stricter protocol, because you know that you are scared from within. Now, how panic, it will give you a negative frame of mind. You will start looking everything through that colored glass where everything looks grim, you will not have a positive attitude. And believe me, that once you get into that frame of mind that nothing is looking good, everything is spiraling down the line, you start looking at every investigation with a microscope. Why did my blood counts fall by 10, or why did my D dimer levels increase by 15? And really, there is no answer to that, and even a doctor will not be able to help you. So at this point in time, I would say to all those patients who have cancer and might be suffering from COVID is that you should have a positive frame of mind. Just like you, when you started your cancer treatment, you trusted your doctor, you prayed hard, and you ensured that you will come out of cancer. Same way, you will come out of COVID by maintaining a positive frame of mind, by keeping faith in your doctors, and having a good, strong family support at this point in time is the most important thing which will pull you out of the cancer. That is why I recommend that all patients should be as close to their family at this point in time, other than those who require hospitalization. That is why I say that early hospitalization will actually not help the patients, but it will give them a negative frame of mind, because they will be coped up in an isolated room where they will not be even able to talk to their family. They will just have a phone with them to do a conversation, and they will slip into that rabbit hole where they feel that everything is going bad with them. So that is the worst thing that can happen.
Great. Okay, Dr. Puneet Sharma has another question for you. He says that how safe is steroids for a cancer patient?
Yes, steroids is the new. Steroids, though the good part about steroids is that they are a life-saving medication. But the other problem with steroid is that it's an immunomodulator. It interferes with your immunity. So for a normal cancer patient, I would want to minimize steroids as much as possible. Why so? Because it hampers with our immunity. It hampers with our normal healing process of the body. But wherever it is necessary, so there are some forms of chemotherapy where we have to give steroids before starting those chemotherapies, because they create a very strong reaction. So only and only if steroids are necessary, then only they should be used in any patient, more so in cancer patients. So now,
No, but
like I
in
said,
COVID, I
COVID,
think steroids are being used, doctor. In COVID
yes,
treatment,
yes.
steroids are
So
being. So,
yes.
what happens
So
then? That's what he's
COVID,
asking. Yeah.
COVID take precedence over cancer. Like I said before, COVID take precedence over cancer. Cancer will give you time, 3 to 6 months, to fight that disease, but COVID will not give you that time. And steroids, believe me, are used as a last resort. They might be started early, but they are just to give you that body, that fighting chance, so that it does not deteriorate. So adding steroids in COVID, it will not give you that much problem as much COVID will give you. So COVID gets preference over cancer, and I would not want to put my cancer patients on steroid. But if a patient of cancer gets COVID, then I would definitely want them to get steroids so that they come out of COVID as soon as possible, and then I can start their cancer treatment.
Fantastic. I think it's a great answer. Thank you very much. Okay, doctor, I think we are through with our time. I would like to thank you for such a wonderful and for such a enlightening session for all of us, because I think this was a very important session for me also, because from today onwards, I promise that I won't, use my Spock oximeter every morning and evening as I used to use. You have motivated me, and I'm going to keep it away from me. No more use of it. Okay, another question Puneet has. He's saying, as black fungus is due to heavy doses of steroids, as far as my knowledge. So he's
No,
spoken
Puneet,
about black fungus. So
yes,
would
you're
you
absolutely
would you
right.
like to throw some light on this?
Yes, we are seeing more and more cases of black fungus or mucormycosis, as we know is scientifically, and we are attributing it to high doses of steroids. And these steroid doses, like any medicine is a double-edged sword. Believe me, if any medicine is a double-edged sword, high doses of steroids are required for you to get off your COVID. But these high dose of steroids are now also being found to be responsible for hampering your immunity and making you predisposed to getting this fungal infection. And that is why it's very essential that little things around the patient make a difference, which includes cleaning the oxygen jars, cleaning the humidifier through which oxygen comes, ensure that there is no sharing of oxygen probes between the patients, between the tubing. And these things are the ones which might reduce your chances of acquiring a black fungus infection.
Great. Doctor, as I said, thank you very much. And one more very important information for the audience who are watching today. We are going to get back Dr. Shubham Garg next week again at the same time on the same day, next Friday. And there we are going to discuss about cancer, not COVID. He is a cancer specialist and he has got a huge experience from one of the best hospitals in India, Tata Memorial Hospital. So he knows all, what can be done to help a cancer patient. So in fact, just before the show, I and Dr. Garg were discussing that during these COVID times, how can we help patients more? So we are going to come up with something very special next Friday. We have already discussed between both of us, and we are going to show it to all of you that, what are we coming up next Friday, which will help all of you. The idea is to help all of you. We will, try to ensure that cancer patients don't suffer because of COVID. They cannot come. You see, a lot of people from Bangladesh also want to come to India for treatment, but unfortunately, because of these COVID times, they're not being able to come. So to help them, Dr. Garg has recommended certain things which he's going to streamline, finalize, and discuss with me. And next Friday, we're going to come up with something, a very, very special thing for all of you. So please stay tuned next Friday so that you can hear what is that special thing, what is it that we're going to offer to all our patients in India and Bangladesh, through which, you can get treatment sitting at home, which is very, very important, a very important message. That sitting at home, how you can get treatment is what we are going to share with you next Friday. Moreover, Dr. Garg is going to share a lot of things about cancer, and I'm sure that's going to be an equally enlightening session as this one. So thank you once again, Doctor, for your very valuable time. আপনাদের সবাইকে ধন্যবাদ বাংলাদেশ এবং ভারতে যারা আমাদের প্রোগ্রাম দেখলেন. Thank you everyone in India and Bangladesh for watching our program, and we hope that these programs of Shastho Bondhu will continue to help you, to continue to enlighten you, and continue to give you more awareness about various kinds of diseases. That is what the objective of Shastho Bondhu is, to create awareness about the disease more, so that we do not take wrong decisions, we do not do wrong things, and we do not create unnecessary panic and anxiety, which is not needed. Dr. Garg has very clearly said there is nothing to be tense. We can lead our normal lives, but definitely taking precautions, which includes wearing masks, maintaining social distancing, physical distancing, and of course, sanitizing, maintaining our hygiene. So these are the things we need to do. And of course, going out only when it is necessary, just do not venture out just like that. Avoid parties, avoid socializing. We have still time to socialize. Just a month or two, we need to, face this second wave. Once this is done, we'll be back to normal lives and we'll have a lot of parties again. So this is the message from Shastho Bondhu. Let's stop partying now. We will party. Give us a month or two. We will fight back and we'll party again. Thank you very much, Dr. Garg, once again. Namaskar to you. And we're waiting to meet you next Friday again. Thank you very much.
Definitely. Can't wait. Thank you so much. Thank you.
Thank you very much. Thank you.